So this will be your very own personal asthma management plan. It's very simple and easy to follow, and it has 3 sections. The green section is where we would expect you to be most, if not all of the time. If you're in the green section, your breathing should feel good, you should be sleeping all night, you should be at school, you should be having fun, and most importantly, not missing out on anything because your asthma is playing up. It's got a best peak flow there, so if you do your peak flows, this is your best, and we would expect it to be around about that mark when you're in the green zone. We'll then have your treatment that you take as your preventer inhaler, and at the bottom, instruction on how to use your reliever inhaler. You can use your reliever inhaler up to 4 times in a 24-hour period if needed, and we would certainly encourage you to use it if needed before you're exposed to any of your triggers. This is your plan. If you have any more triggers that you've forgotten to tell me about today, you can just add them. Opening the plan up, the middle section is probably the most important section because that is your warning signs that things aren't quite as good as they should be. And it could be that you've noticed that you're coughing at night time. It could be that you've got symptoms, so you're coughing, you're wheezing, you're feeling out of breath. It may be that you've had a couple of puffs of your inhaler and it hasn't worked as well as it usually does. We would then advise you to have more of the acute treatment, and we would say 6 to 10 puffs of your reliever inhaler every 4 hours. We'd be happy with you doing this at home every 4 hours, but would encourage you to contact your GP to be reviewed within the next 24-36 hours if you can. If it only lasts for 3 hours, we're not quite as happy with that, and we would expect that you seek help within the next 24 hours. That will hopefully just be an appointment with your GP. If you've had 10 puffs but actually you feel it hasn't really made any difference, or it's helped initially and then has worn off very, very quickly, you could be moving over into the red zone. Asthma can be life-threatening, so the red zone is your severe attack, your emergency plan of action. If you still have symptoms of cough, wheeze, shortness of breath, you may be putting a lot more effort into breathing, you may be getting tired. If somebody is with you, they may notice your neck sucking in here, your nostrils flaring, you may find it difficult to speak in a sentence. Any of these symptoms are a medical emergency and you should be contacting 999. While you're waiting for an ambulance to come, we would encourage you to just keep taking a puff of your blue inhaler every 30 seconds until help arrives. On the back of the plan are your details to contact your healthcare professional if needed. If your patient is on a MART regime, we can use the same plan, but it can be adapted slightly. So your green zone would remain the same, but your preventer inhaler, you would have 2 sucks of your preventer inhaler morning and night time. And then for your reliever inhaler, you would use the same inhaler, but have 1 extra suck up to 4 times in a 24-hour period. Your amber zone and your red zone would remain unchanged.